Good evening, everybody. I'm Dr. Bookman and Dr. Armitage with Phil Maytubby from the Oklahoma City County Health Department are with you tonight for the Health Watch. We're missing two of our regulars. Dr. Sublett and Dr. Chansome couldn't be with us tonight, but we'll bring you some new information, hopefully clarify some old information, and make it interesting for everybody. Um, Thank you, John and Phil, for being on. We're going to start off. We've had quite a spike this last week, 27% increase in cases, most of them Delta, but all the news seems to center around Omicron. We now have Omicron in 18 states, but really only a few hundred cases total. Delta still seems to be 99+% of all the cases. Um, what is the county doing, Phil, about sequencing for Omicron, looking for it? And what are we doing about the big spike? Are we seeing it here in our hospitals and in Oklahoma County?
Larry, we are seeing we're seeing a case rate rise. We're seeing a rise in hospitalizations. So that was to be expected. We predicted that before the holidays because that's going to happen anyway, and it has. So as far as the sequencing question, all labs are supposed to submit 10% of their positive samples for sequencing, and those are going to the pandemic lab up in Stillwater. So we expect to see some results back pretty quick. The last ones we had back showed no Omicron, but I'll just tell you, I mean, it's inevitable. I mean, we will get some Omicron here. It's just a matter of what does that really mean, because there's a lot of variability here, and a lot of the studies are just really early on Omicron. So at least the early studies right now look like it's going to have the ability to spread even faster than Delta, but that the symptomology may be less. I mean, that follows a typical virology plan. I mean, viruses that's what they do. The viruses try to find ways for them to replicate and to survive better and not kill their host. So this is following that typical virology plan.
And we talked about that last week, that typical virology, that the viruses want to be able to spread, and for them to survive, they have to change. They do so by infecting an individual, staying there long enough, not killing the host, as you said, so that they can be spread to another person, another host. That's how these mutations occur. Uh, we've seen that there seems to be significant interest in the Omicron with more than 50 mutations. John, what's your feeling about what our vaccines are going to be like? I know we don't have answers, but people want to know. They're vaccinated. Many have had boosters. Was it worth it? Should they have waited? What's going to happen, do you think?
Well, I'll first say that I'm a pathologist and not Dr. Chansome, an infectious disease expert. So take it with a grain of salt. But I think the vaccines have been a tremendous success. I think, if you're talking about reducing the hospitalizations, reducing death rates, making the virus more survivable, less impactful. Obviously, it doesn't stop the spread. It doesn't even stop cases necessarily, but it certainly takes the edge off of the worst outcomes. And I think the booster is going the same direction, where the booster is proving to be safe, and it's proving to continue to hold that edge against the virus. And probably Omicron, there's no reason to believe right now that it won't continue to offer that survivability, symptomatic relief in terms of not ending up in the hospital or on a ventilator or in a coffin. Again, I think it's still a success story. I was reading that boosters are getting a boost from Omicron, which I think is probably a silver lining to the latest variant getting popular in the press and getting a lot of attention. But the rates of boosters I saw was only at 20%. So clearly, this is a direction that I think we need to reinforce. Why wait on a booster is essentially, what are you waiting for at this point? I think we've opened up the eligibility for boosters a lot, and you could try and time it, I guess, based on your age or your perceived susceptibility. But the question is, why would you? What are you playing for? A different month? You'd rather get your shot in February and not in December. Again, I think we really need to lean into the boosters. That seems like the wisest, and obviously the original vaccinations, which again, we're getting a little bit muddled here because now we've got boosters and primary vaccinations, and did you get both shots or one shot? And we run the risk of just swirling into so many permutations. Get your primary first, that's the most important, and then move from there. But again, Phil's probably a lot more versed on strategies to inspire people and to motivate people, because we need a lot of diverse messages. I think one size fits some. We need many sizes fitting many.
Sure. So I can address that a little bit. Right now, the biggest thing that we know is, or at least the initial findings are, that the boosters and being fully vaccinated really does help. So those studies should show even more pretty quick. We're still pretty early with Omicron. So, we need to look at the studies for the effects against the vaccine. We need to look at it for the effects against the antibody treatments for individuals. So there's a lot there that we're going to have to address.
I think one of the issues that needs to be addressed, and we're going to answer a question that came up with this. Number one, I think it's real important that what we have seen from Omicron to this point, which is very early, but it does not appear that prior infection prevents you from getting infected with Omicron. And that's real important, because I hear people all the time say, oh, I had the infection, 7 months ago, a year ago, whatever. Why do I need the vaccine or boosters? Well, the facts are that studies show that even one shot, if you've had the infection, greatly increases your antibodies. And now with Omicron not responding to prior antibodies, prior infection, still being able to get infected again, it's absolutely essential that everybody gets vaccinated. We had a question, why does the vaccine lose its effectiveness? And I think that antibodies are there's two parts to immunity. And the one we talk most about is antibodies, and antibodies go up with infection and come down. And what we found is that they don't lose their total effectiveness, but they become less effective after about 6 months, 2 months with J&J. And that's why boosters are being recommended, to build those antibodies back up high enough to fight off the infection, especially during the winter when people have come inside. We're seeing an increase as it is. So it's very important that people understand you're not protected from natural immunity, and you need both the vaccine and the boosters at this point. Phil, do you have other points you could add to that?
Well, just if one thing to keep in mind, I thought you hit it pretty well. Coronavirus, there's another very common coronavirus, and it's the common cold. So, and plus, I want you to keep in mind why we get flu shots every year. It's the same reasoning. You get a shot, it boosts your antibody levels for a certain amount of time, and then they start to wane. So not much to add to that discussion. So that's pretty generic.
One of the interesting things I think for this variant, it's good to know that the vaccine manufacturers, they're obviously attuned to what their boosters need to do in the future. I mean, it's nice to know that the muscle that we built during the pandemic around the initial vaccines looks like it's deployable as we evolve this, because certainly the last thing you want to do is get into what happens with orphan drugs and things that don't have that kind of guaranteed support. And in this case, the governments back in the Trump administration and the Biden administration have supported the vaccine manufacturers. And that's been an important ingredient to getting rapid development and a lot of resources thrown against this. So I think the variants are going to continue to play that same game plan. And I think that's good news for us all. And presumably the same with the monoclonals and the even the antivirals. They're going to continue to be aggressively developed because we're throwing the resources. And some people might say, well, that's propping up big pharma. I don't think you're going to argue that when you're on the other end of a ventilator. I think the kind of resource that we're seeing is exactly what, we pay for with our pharmaceutical, it's a lot of money we spend on drugs, but we have a really powerful drug industry because of that. And in this pandemic, we're the leaders. I mean, nobody's talking about the Chinese vaccine anymore. Nobody's talking about competitors to what America was able to deliver. And that's going to continue through the boosters, I think. We'll probably be way ahead of the competition because we've got the muscle and we've got the willingness, kind of the determination when it comes to COVID. I kind of wish we had that same determination with heart disease and a lot of other problems, but certainly this has hit the right notes and everybody's paying attention. And I think that's going to continue to be a good story for us.
And we've certainly come a long ways in the last year and a half, 2 years, especially scientifically with the production of the vaccines. And now Moderna has released information that it has begun studies, not only just development, but studies of three different patterns to look at boosters. The first is getting a double dose booster, 100 microgram. They're looking at whether that'll be effective against the variants, especially Omicron. They've also had a specific Omicron messenger RNA being developed, and they're going to study that, as well as a multi-faceted study looking at both 50 and 100 microgram with parts of both Delta and Omicron in the messenger RNA. So for those who understand how these vaccines are being developed, they use a CRISPR unit that is able to target what they want to delete out of the virus so that it dies out. And they're taking parts of Delta, parts of Omicron, putting it into a new vaccine booster and studying that. So and they say they can produce millions of dosages in the next 3 months. So that's the advantage. That's where science has really come into this. The ability to rapidly develop vaccines. I know some people find that a negative, that maybe they're not being studied well, but these have been studied over many, many years. We have now localized them to using in this pandemic. And I think the FDA will rapidly release these new boosters once they are ready for release. But they're being studied. I don't want people to think it's haphazard science. They're being studied, and they're being studied well. But we're going to be able to develop vaccines so much faster than we've ever developed them before.
So, hey, I wanted to add in a little piece there because you guys touched on it. But, as far as the vaccine development goes, hopefully the studies that come out of this Omicron are going to show that either another boost works or something of that nature where we don't have to actually alter the vaccines that are given at some point. Now, at some point, we're going to probably get a big enough change at some point that it's going to require us to put in different variants models into the vaccination that's given as like a yearly booster. I'm hoping that we can get enough people vaccinated where we don't have so much variant production.
John, do you have something?
Yeah, I was just wondering, maybe since I'm not a public health expert by any stretch, I was wondering what we might have learned from our ongoing challenges with flu vaccines and that year to year requirement that resembles boosters and what they might be for us in an endemic world of COVID. What have we learned from getting people to consistently plug into flu vaccines versus, maybe a more sporadic or worse yet, a non-engagement with flu vaccines? Because that seems like a little bit of a template that may inform us. And if there are any positive lessons, what were the tricks that we were able to pick up that got people consistently getting their flu vaccines? Any lessons there we might learn from?
Sure. I mean, especially in years where the flu was specifically severe and we had a good match on the vaccine. So, that's where we sometimes have some difficulties. You know how they do vaccine production for flu? They look at what's circulating in the southern hemisphere, look and see if that's what they think is going to happen in the northern hemisphere. And then we do vaccine development based on that. Most of the time it's pretty accurate. Sometimes it's not. So when it's accurate, that actually makes it very easy for us to message to the public that, hey, this is an effective vaccine. You need to get it. So when it's a miss, it's a little bit, and when I say miss, you're always going to get some protection from the flu vaccine. It just may vary depending on the strains that are circulating that time, because that usually has 2 A's and 2 B's. So when we talk about that context with coronavirus vaccines, it may become something that's kind of similar, where we might look and say, well, for this year, we need a Gamma, we need a Delta, we need a Omicron in our booster, because that's very easy to do with the technology that we have now. So
I think that's still
cell success is what you're saying. If we can somehow pull together the numbers for Omicron or Delta or I guess Alpha, then maybe the public, again, we've been talking on this show a long time about how difficult it is to get a unified response from the public, and how even the numbers become contentious and how they're derived. So, if success is the best strategy for boosters, I would suggest we probably need to figure out what the definition of success is and how to peddle that with confidence to the public. Because right now, segments of the public, I think, are not, not willing to believe that the numbers are transparent or whatever. I think it can be addressed, but it's going to have to be a systematic approach to gaining the confidence in the way we describe boosters as being the path to healthiness.
I think we all accept that vaccine plus boosters is the best approach we have. I'm not saying it's 100%, and by no means are we saying we're going to kill the virus out so that it doesn't exist. But for controlling the disease in our Oklahoma citizens and citizens around the world, vaccines and boosters are the key to it. But what is Oklahoma City County doing as far as the programs to try to get the boosters? Especially, I'd like to hear what we're doing in the young kids, because the percentages there are very bad and not going up rapidly.
Okay. So, yeah, we have a pretty aggressive plan. We have since we started. We've got strike teams that go out each day, and we're working specifically with the schools to get that done. Plus, we've got a nice partner that is now operating in our drive-through, which is up and running, and it's Passport Health. And they are offering the 5 to 11 Pfizer vaccines for the 5 to 11 age group. And it's going really well. So as of right now, we've done about 7.8% of our population from 5 to 11 with 1 dose. We know, we've only had that vaccine for about 3 weeks now. So we know it's going to take a little while to get them there. But we are going to continue to push there. And you're going to see some boosted messaging coming out of Oklahoma City County Health Department here in the next 2 to 3 weeks. really trying to get people to decide to go get a vaccination. And, we've had to even kind of alter the way that we try to get people to listen to us, because it seems like if you if they think you're telling them, they're not going to listen to you. But if you ask them to go do it, they're a little more likely to maybe consider it or go get it done.
Yeah, Oklahomans don't like the mandates, that's for sure. And actually, it's not just in Oklahoma; it's around the country. Mandates, that just the word has become a 4-letter word, and so I do think people doing the right thing, giving them the information, which this show tries to do, and let them make the right decision, which hopefully will be to get a booster, to get a vaccine, to get your kids vaccinated, whatever it is, go and do it.
Do we have, just curious, do we have targets for boosters for the county, or do we have targets? I'm not sure what our latest numbers are for full vaccinations or primary single shot, but I didn't know if we were working towards some sort of sense of, I guess you always want a higher number till you get to 100%, but at some point you probably have to say this is pretty much at an asymptote, and we're not getting much higher than where we are. So I didn't know if we have those numbers now, or if other cities have done anything that we want to look at their approach to sort of setting the markers on success.
Well, to be honest, a lot of other cities are looking at us because we're above the national average on our vaccination rate. And when you consider where we're at, that's a pretty good thing to do. So I'll just kind of give you some numbers right now. So in Oklahoma County, our total population with at least one dose is at 73.4%. So we're making some headway. We're not crashing the doors down, but it's a good steady increase that you can look at and measure every week or every 2 weeks. So for our total population that's totally vaccinated here, it's 59.2%. Now, when you look at our eligible population, which are the 12 and above, or the 5 to 11, hold on, I'm reading you some different data here. So our total population, 12 and above, is 87.1%. And I think that's one of the reasons you're seeing that we're not crashing our hospitalizations and our medical system like we did last year. That was just about out of hand. And I was wondering, how long the hospitals were going to be able to take that. So I think we're showing the effects of having a lot of vaccine in our population right now. Do we have actual targets? No, we don't right now. We're just really encouraging anyone that's eligible to get a booster to go get it done.
I want to try to keep up with some of the questions that are coming in. So I'm trying to read them as you all are talking. I'm not ignoring what you're saying. But one of the questions says, if my child already had COVID, should he or she get the vaccine? Is there an increased risk of myocarditis if he or she has already had COVID? The initial studies did not show that the vaccine or booster or the boosters increase the myocarditis in young kids. I think that children, just like adults, need to be vaccinated and boosted when it's appropriate. I don't think there's anything different. John or Phil, do you have any different take on that subject?
No, just an add-on. You're correct. The studies that have come out on vaccine versus actually having had COVID show that you're much, much more likely to develop myocarditis from the actual live virus, as opposed to the vaccine. So, I mean, if you're trying to weigh out and that's your decision point, then that's an easy one to make.
Right. John, do you have anything to add?
No,
okay.
I don't think so.
One of the questions that also was asked is that, are there any studies to date that show that natural immunity is not neutralizing against the Omicron vaccine? And the Omicron has not been around long enough. I mean, it's only been a week or two since we first, heard about it from the Southern Africa. And as it turns out, it looks like it may have started in Europe even before Southern Africa, but it hadn't been around long enough to have studies. What anecdotal reports are saying is that it appears natural immunity does not protect against Omicron and its 50 mutations. And so I think we have to just go with that those are anecdotal reports, not a scientific double-blinded study. When those come out, which may take months, and I'm sure they will come out, but that will be reported at that time. But right now we're telling you anecdotal reports say it does not, natural immunity does not protect you against Omicron. So I think that's important.
One of the things that's a little bit surprising about Omicron to me, and there's been some speculation I know circulating about why this is the case, but the surprising thing is that there's so many mutations in one variant. And from what I've been hearing, it's probably because the virus had a chance to mutate in maybe a single host and start, instead of having different variants with 5 mutations or 3 mutations and just adding up kind of an accumulative evolution, that this may have been maybe an individual who had the virus, did not control the virus from replicating in the usual fast fashion. Maybe they were immunosuppressed. Maybe they had a hole in their immunity that they were just genetically not equipped to fight the virus the same way the average population is. But because they were incubating the virus or hosting the virus for so long, one strain was able to develop many mutations and then get out into the general population versus getting out early with only a few mutations and then seeing a progression and then another progression. So I thought that was kind of an interesting question of the natural history, that we ended up with kind of a supercharged evolution because of this maybe single environment, long-term progression within one individual. So,
and I think people need to realize that in Africa, at least Southern Africa, only 35% of people are vaccinated. And much of that is not because the vaccine's not available to them. Much of it is from vaccine hesitancy in Southern Africa. They have over 16 million doses that are sitting on the shelves right now, and they say they may end up having to waste some of those dosages. So vaccine hesitancy is not just in the United States, not just in Oklahoma. It's, in other parts of the world as well. And Africa is one of those. And because of such a low vaccination rate, we expect variants to come from it. As we've said, people get infected, they hold those infections. That's how the virus is able to change itself to be able to spread more rapidly. And this is a world economy. We've shown that if it occurs in one country, it's going to end up in all countries. This is truly the weakest link theory. So we've got to get the world vaccinated better than we have. No question about that. One of the things that has really come out the last few weeks, we talked about it a little bit last week, are the new oral therapies. This may change the whole complexion, certainly the social and the psychological part of this disease, to know that there are pills that may help. Pfizer and Merck both have pills. Merck not as effective, only they say 30% now, but the Pfizer pill is 85% effective against hospitalization and death. So something very exciting. Pfizer says it should be out within the next 6 months. Merck got FDA support, and it was very close. 13-10 was the vote. That's not a overwhelming support for it, but it is moving on and hopefully will be available. What do you all think about the oral? Phil?
Well, I can tell you where I think it will be most greatly used, and that's in the areas where there's not the ability to get vaccination readily, like in Africa and places like that, where they really just don't have the level of protection that we have here, and it may, help a lot with death and severe disease. So I think that's probably where you'll see the greatest use of it at first. Will we see it used here? Sure, we will. I mean, if it can potentially lessen somebody's, poor outcomes from the disease, I don't know why they wouldn't take it, or wouldn't be prescribed, by their physician to take it.
John, do you have any comments on the oral medicines?
I think it's a really good advancement. It adds something I think we would have been very anxious to have a summer ago to help us through the worst of the crisis when it was first appearing. And it's good to know we've got multiple, because I think you're going to see different effectiveness with any drug. It's a trade-off of certain pros and certain cons. So it's great that we've got multiple already. And hopefully we continue to develop this strategy, because at the end of the day, it just adds another layer. This is, a multi-prong approach, and certainly the acceptability. Most Americans don't like shots, but they don't mind popping pills. Probably we're the best country in the world for popping pills when it comes to it. We got more people getting medicated than anybody else, probably. So again, this fits a pattern of convenience. It hopefully gives some psychological relief to folks who are facing a new diagnosis, to know there's another step in the mitigation. So I hope we're investigating more and more of these options, and the more money and research that goes into antivirals, who knows, this drug might just be a blockbuster for the next virus that comes along. Because if you'll remember, we tried to throw just about everything we had against COVID, and some of them, unfortunately, were anti-parasitic drugs that got a lot of popularity. But just increasing the range of approved medications gives us, for the next go round, just more tools. So, I don't want to paint doom and gloom here that we're going to be fighting another pandemic anytime soon, but, hey, this is all research. It's all strength that's going into our ability to deal with the next pandemic.
Yeah, I think people don't really realize what a significant advancement in medicine messenger RNA vaccines are. Huge advancement over where we've been before, and our ability to make a vaccine quickly and safely. So one of the questions asked was, will the pills help the unvaccinated? And yes, the pills are different than the vaccine. I'm not sure we're getting feedback. Different than the vaccine, the pills prevent the virus from replicating. That's how we get the mutations, is as they replicate. And both these pills prevent replication, therefore the virus dies out. It will work on the unvaccinated, it will work on the vaccinated. It needs to be taken, hopefully, within the first 5 days after either symptoms or diagnosis. And it's a lot of pills. One of them is 4 pills twice a day for 5 days. One is 3 pills twice a day for 5 days. So you're talking 30 or 40 pills in a short period of time. One of the problems is that, at least with the Merck, is that there's been some worry that it may cause fetal abnormalities. So that it's not being recommended for young children. It's not being recommended for pregnant women. And that needs to be sorted out. People need to have confidence before they'll take the pills. We went through this with the shots, where people weren't confident because of how quickly they came out. People need to be confident that if it gets approved, and it hadn't been yet, but if it is, that it's safe for those who take it. The other issue that just came out, I read an article yesterday, and I don't know how important this is, but I know some will comment on it. And that's that right now, the oral pills would be paid for by the government, but the pharmacist will not get paid for dispensing the pills. And they're throwing a fit through their union that they're not getting paid to dispense these medicines. What do y'all think about that? I mean, we're getting paid well on this show, so you know.
I mean, I don't know why you'd want to leave people out. You know, part of the success of this has been making a lot of people interested in putting all the pieces of the puzzle together to deliver the drugs, the treatment, the vaccines, whatever it was. It seems odd to me that you would leave elements out of the functioning system, and especially at a time when our government seems to have no problem throwing a lot of money at a lot of places. You know, do I want, you know, a COVID drug delivery more than I want windmills? I'd say this, you know, COVID pills worry me a lot more than windmills do right now. So again, throwing the resources, it seems odd that we would pick you know, one little segment of the whole supply chain, as it were, to leave out of the equation when clearly we're throwing so many resources at this. But
yeah, I agree. It's a process issue. No process is successful unless you complete the whole process. So by not paying them, you know, why would they even be interested in dispensing them? So it's pretty simple to me.
Yeah, and this is a CMS decision because private insurance follows CMS being Medicare, Medicaid. And so it's really going to be up to them.
No, it's so contrary. I mean, one of the lessons we've talked about on this show earlier was the success that we didn't put a lot of barriers. When care was being, you know, COVID care, the government said we're going to look after everybody. So people without insurance could get care, and people, I mean, that's been one of the success stories, was throwing a lot of access. We almost have, for the scary proposition, we almost have a universal health plan for COVID, right? So, you know, looking at that, why would you try and pick that apart for what is probably chump change in the whole equation? That, you know, it's like taking the learnings that we've hard-earned learnings from this whole thing and starting to throw pieces out. Anyway, it's depressing when we've made progress and we seem to be on a winning hand, and somebody decides to reshuffle the deck. I mean, what?
Yeah, Julie says a processing fee to the pharmacist is not unreasonable. We're supportive of our pharmacists. They put in the work. They have to, you know, keep the medication. They have to deliver the medication. I'm all in favor of them getting paid as they would for any other medication. And, you know, if the physicians had a say, they would. Unfortunately, we don't have a say. So this is going to be a federal decision, and you know, flip a coin. Who knows which way they'll go?
Well, we should put up the CMS administrators' email so we can all send them a note saying that we're horrified that people are being left out of the solution.
One of the questions that
I don't think I can blame him for this. He probably isn't in charge of CMS, but
yeah. One of the questions that we've gotten that I don't have an answer to, I have an opinion, and that is, you know, how long will the immunity, the antibody response from a booster, how long will it last? How long will the protection last? And I can clearly say that those studies haven't been done. I mean, people need to realize to get the studies for us to have the answers takes time. And we've only been doing boosters now for 2 months, I guess, maybe a month and a half, not long enough to see how long protection's going to last. I'd love to think it'll last a year. I don't know that it will, and especially as mutations occur. I'll I'll seek your all's opinions. What do you think?
Well, based on, again, it is too early to tell. But I mean, if you based it on what your protection rate is at fully vaccinated, which is about 6 months. So I would hope that the booster would last at least that, because your system's already primed. It already knows how to produce the antibodies. But Dr. Armitage might be able to answer that a little better than I can.
Yeah, the data's out. I think that, one of the things we owe it to the public to do the studies and make the data as transparent as we can. It may be different for different age groups. It's probably different for different risk groups, maybe. But again, I think the public's going to gain confidence if they see that, the answer has depth in terms of it. People have looked at it and tried to divide it into meaningful segments that the public can say, hey, it's not one size fits all. I'd be surprised if it's one size fits all. And hopefully we're addressing that. And if I saw that they were doing, say, an age profile of immunity and its longevity of the booster effect, that would just give me more confidence. I'd be like, look, they're slicing and dicing this in a way that makes sense with biology, and certainly with this virus, how it's got the age prevalence so much higher for the older age groups. So, hopefully that can be part of this, to know that the data itself is a sales tool. And when you talked about the flu vaccine and having confidence because of the quality of the vaccine in a given year, the quality of the data is what drives the confidence. And the boosters need to, hopefully we're collecting the data that'll allow us to present to the public answers. They want it on this show, right? The public is really sophisticated. They're asking all the right questions 2 months into booster land. So let's give them what they want. And better yet, let's tell them we're collecting the data beforehand so they can know that it's on its way and not sit back and guess. And into a vacuum comes all your conspiracy theories. So, fight the conspiracy theories, put out the good roadmap to where we're going with the data, where we're going with the answers and the analysis, hopefully that supports that. And I'm sorry, I'm going to retro here for a second. One of the other lessons I think this pandemic has taught us, not only have we learned a lot about mRNA and vaccines and maybe introduced some new antivirals, the other thing that I hope comes from this, that we learn some lessons, is a more rapid approach to youth and those under 18 for getting access to therapies. I think we've always tended to deal with them after the fact, just because of legal requirements of parental consent and the difficulties and question marks around the ethics of younger people being involved with clinical trials. Well, I hope this has been a wake-up call that we, at certain times in certain conditions, we want to fast track to be able to design studies and enroll participants earlier rather than later, because I think the delay is something that was somewhat self-imposed just by the traditions of clinical research in this country. And at some point, we need to have a fast track around that if it's decided it's something like a pandemic. Heaven help us if the next pandemic hits kids harder than it hits adults. Then we'll be completely reversed on our ability to activate the research system. So
I agree with that. And I would add, the other thing that we've learned is how important communication is at the federal, at the state, at the county, at the city levels. As you said, and I absolutely agree, the audience, the people are far more sophisticated. Between social networking, the internet, CNN, and all the other 24-hour news shows, the amount of information that's put out is incredible. And people need to have answers quickly and accurately. Unfortunately, there was a lot of disinformation, a lot of misinformation. And that's sort of what started this show, was just trying to put out information that was, accurate, true, saying we don't know when we don't know, or there hadn't been enough time for the studies to be done. But I think in the future, we need to learn a valuable lesson that medicine has to communicate better from all aspects. And I think that's caused a lot of harm in our society and in our state. I heard tonight over 12,000 Oklahomans now have died from this disease. Unheard of. And it should never happen again like this. Phil?
Yeah, I do have a little piece of good information.
Yes.
We just hit 1 million vaccinations in Oklahoma County last week. 1 million. So,
very good.
You know, that takes everyone. We have over 500 pandemic providers that are doing vaccinations. I mean, we do our part, but we're just part of the machine. We couldn't do it without all these pharmacies and all these hospitals and all these providers doing their part, and they have done it.
You know,
I'm sorry Dr. Chansom's not on the call, because we can congratulate him on driving around with his little mobile out of his trunk vaccine workshop there. So
yeah, the vaccine mobile. One of the questions that came up, and I'm sorry Dr. Sublet's not on, because he could answer it better than either John or I, who are not clinically involved right now. And that is that why don't more providers, physicians in the communities supply the vaccine, and especially for children. The question was that my child would like to have the doctor there if they get the vaccine. Well, as I understand it, doctors' offices are offering it, quite a few of them. I don't have a number, and Phil, if you have any information, please inform our audience.
Sure. So I can tell you that the difficulties that we had early with storage of especially Pfizer vaccine, because it's delivered with a glycolipid, has to be very, very cold. So not every doctor's office can still store the vaccine and keep it frozen. So one of the things that we're doing at the health department here in Oklahoma County is we're managing the vaccines for a lot of these providers ourselves. I mean, we're actually storing it and delivering it where they can do it in an appropriate amount of time where it doesn't outdate. So, I mean, it's what we have. So trying to find these -70 refrigerator or freezers is not that easy.
My garage is capable. It's where I keep other things. So I do know that pediatricians around the state, a lot of them are giving the vaccine. I think my answer to Julie, it would be simply talk to your pediatrician, see if they're able to give it. If they're not, see who they would recommend. Because there are a lot of physicians or physician offices around the state, especially pediatricians, who are giving the vaccine.
John, I hate to. I know we're approaching the end of the hour here, so I hate to uncork anything too controversial. But I didn't know if maybe Phil or Larry, you had any thoughts on the New York City. I guess they're going to mandate private employers give the vaccine. Mayor de Blasio, I think that's one of his parting gestures. And then the government stepped back from its mandate for all its workers. So to me, it seems like the politicians are busy at it again, sending confusing signals, and they don't seem to have a very good standard playbook, or maybe the playbook is to do the opposite of what the other guy is doing, so you can pick them apart. But I find it very confusing that we're going in multiple different directions out of different government agencies, and there doesn't seem to be a spirit of alignment anywhere. And that's a shame, because I think they're just adding another element to this that's almost gratuitous at this point. Clearly, one of these approaches is defensible, or more defensible, or should be the way we're going, but they're at such opposite ends a mandate that was retracted and a new mandate that's even more aggressive. I didn't know if you had any thoughts around this cacophony of political positioning.
Well, it just adds to the indecision again. I mean, that's why people are like, what do I do? Because I don't know who to listen to at this point. But one thing to keep in mind, there's a lot of judgments that are out there pending. Like federal judges are making rulings on these vaccine mandates. That's why I think you've seen a different approach coming in. Now it's a recommendation as opposed to a mandate until they get a judicial ruling. I think we've got Fifth Circuit about to, I think they're going to hear it first. So we'll see what happens there.
But even leading into that, I'm sorry I interrupted you, Larry, but even leading into that, there was the go ahead and do it and don't wait for the decision, which was a weird way of saying kind of bypass the process in a way. And then today, with New York, this is after the fact. This is after all those appeals court or those appeals have been heard and the injunctions have been launched. So why would you go stepping off in that direction? I agree with your comment that there's a lot of litigation that's probably going to sort out where we end on a lot of these subjects. But to throw in a new mandate, to me, it's almost like political malpractice, if there is such a thing. But because there's no new ground. That pronouncement goes against the trend that everybody else that you articulated. This has gone to be adjudicated, and let's wait and see where the bodies come out on that.
But John, I think you said the most important fact. This was de Blasio's parting message, sort of his shot across the bow. It's a political guillotine if he were running for re-election, but he's not. And so he can make this mandate and make it sound like it's common sense when it goes against everything the courts have judged so far. And I think the word mandate is the key. People don't want to be forced to do something. They want to be able to make a decision. Now, it may be reasonable to have everybody vaccinated. It may make common sense. It may be in the best health of the country and of your fellow citizens, but people don't care about that. They only care that they get to make the decision. And if you put the word mandate to it, it's not going to fly, at least not in this country anymore.
Well, I think we need to call that behavior out. Those people who have the opinion that was political showmanship, it was selfish. Even if the mandate is right in and of itself, the way it's done at this time is inappropriate, and it doesn't help us. It hurts the overall consensus building, aligning by just throwing another random voice into the echo chambers, and again, very frustrating. But I think it's worth calling out. If we don't start doing some hygiene around our politicians and our communication and the way that science has become a football that gets, I shouldn't mention football on the show this week, but sorry. But at any rate, I think people who want to get to the best answer, the most unified, smartest voices need to call out the really bad behaviors. And I've certainly been unforgiving for a lot of what Fauci does, but this is on the same order of magnitude by my way of thinking. This is just inappropriate gamesmanship and personal aggrandizement that's going to hurt our overall community's ability to fight this pandemic.
Yeah, I mean, where you're going is the politicization of science again. I mean, if we take this back 10 years, there would be no political person telling us who need to get it vaccinated. It would have been CDC or FDA. Yeah. So we need to let the science get back in control.
I agree. And Melissa said it best. She sent not a question, but a statement. It's all the political mess that are keeping people from getting vaccinated. And I do believe the politicization of this whole process has created much much of the problem that we're experiencing. Well, we've sort of come to the end of our hour. I don't think we're going to be able to answer all questions at this point. I will read the last one. It says, Mr. Maytubby, I think the Oklahoma County Health Department has done, and it should be a great job getting our county vaccinated. Thank you. Wish the entire state would follow suit. And I think that's the best way to end it. Thank you, Mr. Maytubby.
Oh, we have a great staff and they put their heart into it. So it's all for the people here. So we're thinking of you when we're doing this. It's not us.
Those of us who live in Oklahoma County appreciate it and certainly benefit from it. So I want to thank both Dr. Armitage and Mr. Maytubby for being on tonight. The hour went quickly. I thought we'd, quit early, but it's a little after 8 o'clock. And
I thought the second half of the show was going to be on Coach Venables.
Well, it was. Actually, I had that ready, but it didn't allow itself. So I'll end the show with Boomer Sooner.
And Boo Baylor.